Hello, everyone. Dr. Glenna here, reminding you that therapy is a lifestyle, and this is the happy hour. Thank you very much for joining me today. Again, my name is Dr. Glenna. I am a licensed clinical social worker with a private practice in Torrance, California, where I specialize in anxiety-based disorders and emotional abuse recovery. I help people redesign their lives after healing from trauma, and I would love to help you. I'm currently accepting new clients in the state of California. This is the happy hour. The happy hour is our weekly wellness webinar. It is completely free every Wednesday at 1:30 Pacific Standard Time. And if you miss it, if you can't catch it live, you can always watch the replays on YouTube. The happy hour is not to be used in lieu of any psychiatric service or any mental health therapy that has been recommended for you or prescribed. If you are experiencing any mental health symptoms, please contact a licensed professional, your primary care physician, or a psychiatrist. This is for educational purposes only. I like to give practical tips and tools and things that you can use in conjunction with whatever you are doing with your therapist. So the happy hour is not to be used in lieu of therapy. It's not to be used in lieu of medication or anything else that's been recommended to you. The happy hour is for educational purposes only. And with that, let's get educated. Let's jump on in. There we go. All right. Today, we're going to talk about how to choose the right mental health professional, understanding therapy credentials in California. My name is Dr. Glenna, and what have I not said? I like vanilla over chocolate, vanilla everything over chocolate. My sister prefers chocolate, I prefer vanilla. All right, why this conversation matters. Mental health content is everywhere. Social media, podcast, YouTube, influencers, motivational speakers, coaches, clinicians, etc. The blessing of the internet is that it makes information accessible to everyone. It allows you to learn at your own pace. You can research people in the privacy of your own home. We love the internet, right? The internet it's a great thing. The problem is that the source of information is unregulated. The public is more familiar with the nuances between medical doctors, like a dentist versus an orthodontist. But we, as mental health professionals, we haven't done a good enough job of being clear about the nuances in our field. So lately, there's been a lot of conversation around credentials. And to be very transparent, I blame me, people like me. I take full accountability. The fact that there's so much conversation and people are so unclear on the differences between the nuances, yet we keep encouraging everybody to go get mental health services, that's a reflection on us. We in the mental health community, we haven't done a good enough job of explaining to you guys and educating to you guys the differences in our credentials and who is the best fit for you and at what time. So I wanted to not spend today so much on focusing on psychodynamic topics, but to slow down the pace and make sure that I'm giving you a resource or a place that you can go where you can learn what does all this mean. Even my credentials. My name is Dr. Glenna because I have a doctorate in social work, but I was licensed before the doctorate. So people don't know that. They don't understand how that works. So I just wanted to take today to explain those things. Why do credentials even matter? Because if somebody is suicidal, and there is a difference between being actively suicidal and having suicidal ideation, it doesn't matter. If you are actively suicidal, meaning you have a plan and you have full intention of harming yourself, or you are having suicidal thoughts, you're thinking anything from the world would be better if I wasn't here, or what if I just stepped in front of this car? Somebody that is severely anxious. We're not talking about just the regular anxiety that comes with, going to work and managing kids and just everyday life, but we're talking about severe anxiety. If you have experienced trauma, especially a series of traumatic things over a period of time, if you are dissociating, if someone is talking to you and you are not dialed in, you are in a different place, you're in a different time, you can't stay grounded. If you are currently experiencing abuse, or you have experienced abuse, if you have a personality disorder, which you're probably not aware of it because the very nature of personality disorders means it's embedded in kind of how you are and how you operate. But personality disorders are major mental illness or dealing with severe depression. You need a person that is trained to assess risk. You need a person that is trained to diagnose accurately. You need someone that is trained to treat you clinically. You need somebody that recognizes, I'm sorry, this is a typo in there, but that recognizes the things that come up and the difference between generalized anxiety and depression with anxiety as a symptoms. And you need somebody that's going to follow ethical standards. Because when we're talking about major areas of your life and major mental health issues, you need a person that is trained to properly evaluate those things. What does licensed actually mean? Now, I say it at the beginning of every single happy hour. I introduce myself and I say, I'm a licensed clinical social worker. And I say, if you are experiencing any mental health symptoms, please contact your primary care physician, a licensed clinician, or a psychiatrist. So, what does licensed even mean? A person that is licensed, and I'm speaking for the state of California. I'm licensed in the state of California. Anything outside of California is outside of my scope. Other states have similar licensing guidelines, but I can only speak specifically to the state of California. Licensure in the state of California means you have completed a master's, a PsyD, or a PhD in the relevant field. Oftentimes, it's counseling, psychology, social work, marriage and family therapy, so on and so forth. But you have completed a master's program in one of these relevant fields. You have also completed additional direct HIPAA compliant service hours under a clinical supervisor, meaning you've done, and the social workers, we do an additional 3,000 hours after we finish our license. I mean, after we finish our master's program. Okay. We do an additional 3,000 hours of one-on-one therapy with a clinical supervisor that is observing us. So, not physically in the room observing us, but we are under someone else's license for an additional 3,000 hours. This is HIPAA compliant service. This is not done publicly. It's not done casually. It's not like volunteer work where your friend can just kind of sign off. These are additional hours that are HIPAA compliant under clinical supervision. It also means that you have sat and passed your state licensure exam. Very clear cut. You sit for licensure, you either pass or you failed. And if you failed, you go back and you do it again. It also means that you need to renew your license every 2 years, meaning you pay for it. You finish your send in paperwork to verify that you don't have any legal proceedings or any legal reason why they should not renew your license. And in order to submit that every 2 years, you need to finish a certain amount of continuing education units. This makes sure that we are up on the newest trends and just kind of what's the latest and the greatest in terms of what's going on. For example, I've been licensed since 2013. In 13 years, a lot of things have changed. And so continued education units, it makes sure that I'm kind of boots on the ground in terms of what's the latest and the greatest legally, ethically, and academically. And licensure means that there is a certain level of accountability. I am accountable to the Board of Behavioral Sciences. I'll get into who that is in a bit. It means I have to answer to somebody. Even though I'm operating independently, I do have to answer to somebody. It means that there is regulation. So I can't just be out here, guns a-blazing all willy-nilly. There is regulation. Because I'm accountable to somebody, there's a certain level of oversight also. I operate independently, but the Board of Behavioral Sciences, the NASW, National Association of Social Workers, there's a certain amount of oversight that makes sure that whoever you are, whatever your credentials are, they're under a certain framework and under certain guidelines. And it also means that we have standardized training. It means that we are all funneled through the same academic source, and it ensures that what you're getting is through a very specific lens. Let's be clear, a degree alone does not automatically equal licensure. Having a master's in social work does not automatically mean you are a licensed clinical social worker. The one where it's tricky is usually with the PsyDs and the PhDs because they are doctor, but it gets confusing because having the degree alone does not equate to licensure. Having a degree alone does not equate to clinical competency. I'm going to get into it later on in terms of how do you go about selecting the right professional for you, and credentials alone does not equate to clinical competency. And it certainly does not authorize you to treat people independently. So the degree alone does not mean that you can sit behind a door and treat people. How to search a license. Now, I mentioned the Board of Behavioral Sciences. The Board of Behavioral Sciences, the BBS, is where social workers, licensed marriage and family therapists, licensed professional counselors, and licensed educational psychologists. This is who holds our license. It's very easy. You go to the Board of Behavioral Sciences website. You can type in my first and last name, and it'll come up. 29867 is my license number. And it'll say how long I've been licensed and when my license is going to expire, which is December of 2026. All of this information is public information. Okay. So anytime you are researching someone or dealing with someone and you're trying to figure out, well, are they licensed? Do they even have permission to operate in this capacity? You can go to the Board of Behavioral Sciences. There is also the California Board of Psychology. This is where PsyDs and PhDs, people that have a PhD in psychology, their license is held in the Board of Psychology. Okay, California Board of Psychology. Same thing. You go to the website, you type in their first and last name, and it'll show you whether their license is active, so on and so forth. All of this information is public information. Okay. So anywhere you go, whether you're talking to someone in private practice or if you're talking to someone where they're under like a group practice and your insurance is sending you there, this licensing is public information so that the public is able to do your due diligence and make sure that the person that you're speaking to is properly credentialed. Let's talk about the differences in the types of people that you can work with when you're asking for help. Okay, so let's talk about coaches. Um, I always say there's coaches and then there's licensed clinicians. And it's kind of like the difference between a chiropractor and a massage therapist, right? Both are valuable in different ways and at different times. Sometimes you need a chiropractor. Sometimes you don't need all that. Sometimes what you need is a solid massage therapist. The type of education that they get is different, but they both are valuable in different ways. And if you are having some severe pain and you go get a massage, there's times where the massage could be great, but actually what you need is something from a chiropractor, right? So just using that as an example, I want to be very clear. Some of my favorite, most respected people are coaches. And I'm actually going to sit down and interview a few of them, and I will post the interview so that you can see them. Naja Hall, David Burris are two of the most amazing coaches I've ever seen. And so I have a healthy respect for coaches and what they do. I just think we should all be really clear on what coaches do versus what clinicians do and when you should be contacting one versus the other, right? Coaches typically focus on motivation. And motivation could literally be like encouragement motivation, and motivation could literally be motivating you to get from A to B. They focus on accountability. What do you say you're going to do? Then this is what we're going to do. A business coach would be the same, like, what are your goals? A job coach, a performance coach, right? Not necessarily sports coaches, because that's not what we're talking about here, but we're talking about coaches that are going to sit down in front of you in a counseling kind of format. They focus on accountability. They focus on you changing your habits. What are you doing today? What do we want to do tomorrow? And what incremental habits do we need to change in order to get to that point? You can have a business coach. That's a type of coaching. Business coaches are great. They're amazing. Mindset. They focus on some of the mindset things that are blocking you from doing whatever it is that you really want to do. They focus on the way that you think about things, the way that you perceive yourself, the way that you perceive other people. And they have some very effective techniques for helping you shift your mindset so that you can be more effective. They focus on insight. A good coach will help you to get more insight into your own behavior, what's getting in your way, what's stopping you from achieving what you really want to achieve. And along that same vein, a good coach focuses on goal achievement. Sometimes that goal is a better quality of life inside your home. Sometimes that coach has to do with a couple, like David Burris is an amazing couples coach, and he has to do with goal achievement. And sometimes the goal is better communication for the couple, right? And similarly, relational alignment. So again, mentioning David Burris again, focusing on relational alignment, helping two people, because in a couple situation, you are two different people with different ideas about how things are supposed to go, right? So when you have a coach, they help you with relational alignment. They help those two different people that love each other get on the same page about the direction of the relationship. Coaches are typically best for high functioning individuals, meaning people that are able to kind of go to work, take care of their kids. This would not be a person that was suffering from depression. That would not be appropriate for a coach. They are also most appropriate for performance goals. Again, coaches are goal oriented, right? They're going to help you get some insight into yourself, into your thought process, but they are focused more on goals. A good coach will also um, focus on structure and accountability. So, structuring your time, structuring your life, and holding you accountable. Because sometimes we need to do things mechanically before they can become organic. So sometimes it is a matter of setting an alarm to do something, having someone call you, having accountability groups so that you can really change the structure of your life until it is now organically how you go about doing things. And coaches are amazing for lifestyle development. When you want some changes in your life, a coach is one of the best people that you can call for that. Coaches are not designed for diagnosing mental illness. A coach is not qualified to diagnose mental illness of any sort. And I know we talk about depression, we talk about anxiety. Those are two very popular mood disorders that we talk about, but a coach is not qualified to say, oh, you're suffering from depression. Even that verbiage is a form of diagnosing, and it's grossly inappropriate. As a matter of fact, if a coach is working with someone and they realize that the person is struggling with depression or struggling with any sort of mental disorder, now they need to refer to a licensed clinician. A coach is not designed to treat trauma. It doesn't mean that they can't work on your mindset and some insight if you've experienced trauma. I don't want you to hear that if you have any trauma in your life, you can't go to a coach. That's not what I'm saying. But a coach is not designed to treat trauma. A coach is not designed to do some of the psychodynamic techniques that unwind trauma, right? A coach cannot assess for suicidality. If a coach realizes that that is a part of the conversation, they need to refer to a licensed clinician. If it's in front of them, then they do what they need to do. Because what can you do when the person is sitting in front of you? But it's not appropriate that they should be addressing suicidal ideation or a person that is actively suicidal. And coaches cannot clinically treat anxiety disorders. Now, again, everyone has anxiety. Right? Anxiety is an emotion. It's a warning system for your body to realize that something may be wrong and that you may need to take action. Having anxiety in and of itself is not the issue, but having anxiety that is beyond your control, that is now managing parts of your life for you, now that's where it becomes problematic. So can a coach work with you in terms of your habits, accountability, your mindset, and goal achievement around anxiety? Yes, they can. But once it gets to the point where it's problematic in your life, that's not appropriate for a coach anymore. A coach can be valuable, but it's not the same as psychotherapy, right? So a good coach recognizes their limits and they recognize like their scope of practice is what we call it. And when they reach their scope of practice, they send you to a person that is more appropriate for you. A licensed clinical social worker. My name is Dr. Glenna. I'm a licensed clinical social worker. Our training focus is mental health. Licensed clinical social workers, we focus on mental health, diagnosing, and treatment, meaning we are trained to diagnose and treat major mental illness. We focus on the system. So the system that you're in, we focus on the idea that everybody is relying on your energy in the system and how that impacts the world around you. We focus on your overall environment. So we're going to talk to you about the things that you're experiencing, but we're also going to acknowledge the relationship that you're in, the home that you're living in, the city that you're living in, how all of these things kind of tie together to impact how you're currently feeling. We also focus on trauma. We focus on some of the horrific things that you've experienced, some of the mildly traumatic things that you experience repeatedly and over a period of time. We're going to talk about family systems. We're going to talk about traditional cultural dynamics. We're going to talk about race, ethnicity, where you grew up and how that affects your family system, your idea of appropriate gender roles and how firstborn, secondborn, lastborn, all of that impacts your personality and how you interact with people. We're going to talk about your social functioning and what that looks like. And social workers are designed for advocacy and case conceptualization. That means that we will advocate for you. That's what social workers do best. That's what Tiggers do best. And case conceptualization, meaning we look at everything overall and we kind of put it on a whiteboard and say, okay, what's the best way to go about serving this person and helping this person? Social workers are often strong in trauma recovery. We have a sensitivity to the things that have happened to you. And so we're pretty good at acknowledging your trauma and helping you to get through it and move forward from it. We're great at treating anxiety, depression, life stressors, again, major mental illness in general. relational issues, and emotional abuse recovery, trauma recovery. That is what we do. Social work lens. Social workers believe in treating the person and environment. So we don't believe in just treating just the person. Yes, you are a whole person, but we're going to look at your entire environment and factor all of those things in. I can't just tell you, you just need to take off work and, go off for a week by yourself when you have, three kids and a partner. We're going to look at you within the context of your environment and make recommendations that are appropriate according to that. Social workers also offer a strengths-based perspective. So rather than look at what's wrong with you, we're going to look at, well, what do you do well? Right? Okay, so reading is not really your jam, but you really do great at art, and that really seems to relax you. So, how can we implement some things that utilize art on a regular basis that help you to calm down? And we also use an eclectic approach, meaning we are trained on psychological techniques. We can use evidence practices with efficacy. That means that there are treatments that have step one, step two, step three. We are fully qualified and we will use those treatments, but we also will draw from different treatments according to what's most appropriate for the client at the time. Social workers, licensed clinical social workers are best designed for trauma-informed therapy, anxiety, mood disorders, major mental illness, emotional regulation, high-functioning adults under stress, and what we consider not high-functioning adults also. LMFTs, licensed marriage and family therapists, social workers and MFTs, MFWs, we're like cousins. Okay. MFTs and social workers, we're like cousins. Very similar, except the MFT focus is a bit more on relationships. Like they specifically have hours when they're getting their hours towards licensure. They specifically have child and family hours. So they are designed to focus more on children, on families, and on couples, more so than what social workers are designed to treat. They focus on relationships. They focus on family dynamics, attachment patterns, communication. Very similar to social workers, but the difference is an LMFT, a licensed marriage and family therapist, does have a focus on children, families, and couples, more so than social workers do. They are often strong in couples therapy, family conflict, family dynamics, relational dynamics, interpersonal communication. They focus on the relational system and the attachment structures. That's more so what LMFTs focus on. They're great for couples work. Another person that I'm going to interview is Melissa Dumas, who's a licensed marriage and family therapist. I send my couples to her. I actually choose not to treat couples. She, on the other hand, is amazing at it. Family therapy, dating, relationship patterns, communication issues. Again, LMFTs and social workers are very close. We're like cousins, but their focus is a bit more on the individual and the family and the children. Licensed professional counselors, LPCCs. Their focus is similar to social workers. Again, we're all kind of in the same family, but they focus more on psychotherapy, emotional disorders, behavioral interventions. They're really looking at the person's behavior and what's impacting things, and they use counseling and diagnosing in order to move you forward. They're very strong in anxiety, mood disorders, adjustment skills, coping overall. And again, professional counselors are really focused on behavioral interventions. Their lens, they're often more individually focused and more on the counseling talking through things, whereas maybe social workers might be a bit more psychodynamic or a bit more focused on trauma. They are best for anxiety, mood disorders in general, mood being how you feel, stress management, and emotional coping. If you go to the BBS website, social workers, MFTs, LPCCs, we are all under the BBS. PsyDs, and PhDs. Now, let me be very transparent. I have a doctorate in social work. I had to make a phone call to a friend of mine that has a PhD in psychology. And we had to sift through to make sure that we understood the difference between PsyDs and PhDs. So that's why I say we as clinicians haven't done a good enough job of explaining it to the general public, because the fact that I had to call a landline, I had to call Dr. Noni Inzeram and make sure that I was clear on the differences between the two. PsyDs, a doctor of psychology, focuses on being a practitioner first and a scholar second, meaning the primary goal for a PsyD and in their education is around individual work and being a clinician and working one-on-one with people. They additionally, they may have a dissertation, but they may also have a project. A PsyD is not necessarily going to contribute to the body of research, but they will as part of their graduation requirement. It might be a dissertation, it might be a capstone, it might be a project of some sort in order for them to complete their PsyD. So with a PsyD, the focus is more on practitioner and scholar second. With a PhD, a doctor of philosophy in psychology, the focus first is being a scientist, being a researcher, and then secondly, it's being a practitioner. Excuse me. Meaning, if they are in a PhD program, it is required that they do research, that they do an experiment, that they conclude a study and contribute to the body of research. Additionally, they are also trained to be a practitioner, but the first goal is to contribute to the body of research. Doctorates use research that PhDs contribute. PsyDs use research that PhDs contribute. PhDs have a dissertation, it's public, it's published. A PsyD and a doctorate, not necessarily. It's actually like for me, again, I have a capstone project. I don't have a dissertation because I have a doctorate. Now, in the state of California, whether you are PsyD or PhD, in order for you to operate independently and have face-to-face conversations or virtual conversations, you still need a license in the state of California. If you have a PsyD, if you have a PhD, you are qualified to do all types of things, to do psych testing, to contribute to research, to teach. A lot of PhDs goes on to education and they're kind of tenure track people and they begin teaching at the graduate and collegiate level. If you would like to do one-on-one work of any sort independently, whether you have a PsyD or a PhD, you need to be licensed. Now, licensed PsyDs, licensed psychologists, again, they're under the Board of Psychology, separate from the BBS, right? So their training focus, it focuses on psychological testing, psych testing is what we call it, doing assessments, diagnostics, uh, personality structures, and severe psychopathology. So, psychologists are the people that are interviewing sociopaths, that are most often treating, like they might be working in the prison system. When you hear about people saying, oh, I want to be evaluated for ADHD, you would go to a licensed psychologist. Those are the people that are trained to administer the scales that help us to understand those things. Okay. They're often strong in complex diagnosis, personality disorders, narcissism, borderline personality disorders, um, schizotypal personality disorders. They are more in that area of the people that would be assessing, diagnosing, and treating those disorders. Neuropsychological assessments. Again, we keep hearing about people being ADHD and autism, right? These are the people that administer the tests to figure out, are you neurodivergent? Severe mental illness, and formal testing and evaluations. These are the people that are qualified to administer those exams. When you want to find, everybody's talking about it right now, which is great. But you would go to a licensed psychologist in order to have that scale administered. They can provide psychological testing, diagnostic clarification, and deeper assessment work. And they are best for diagnostic complexity. Again, when we're talking about sociopaths in the prison system, psychopaths in the prison system. It is the licensed psychologists that are qualified to treat and assess people with this presentation. Personality disorders, severe chronic mental illness, and formal evaluations and testing. So again, it gets a little tricky. Like I mentioned before with myself, I've been licensed in the state of California since 2013. I finished my doctorate in 2018. A social worker does not need a doctorate or a PhD in order to be a licensed clinician. But if a person has a PsyD or a PhD, in order for them to operate independently, they still need a license. Managing or matching the professional to what you need. Coaching helps with productivity, accountability, business goals, confidence building, communication skills, relational alignment. If that is what you're looking for, a coach is perfect for you. I've mentioned David Burris. I've mentioned Naja Hall, two of the best coaches I've ever seen. Great friends of mine. I can call them and I have sent people to them left and right. Amazing coaches. Therapy is more appropriate for unresolved trauma. panic attacks, emotional abuse recovery, suicidal ideation, suicidal thoughts, actively suicidal, substance abuse issues, chronic anxiety. We're not talking about the type of anxiety that you have, when you have something big coming up in your life. We're talking about chronic debilitating anxiety. That's when you should be talking to a therapist. Depression. We're not talking about just feeling a little down here and there. We're talking about when it's heavy on you, when it's preventing you from thinking, from functioning at work, when it's impacting your relationships that you have. You need to be talking to a licensed clinician. Attachment wounds. We've heard about avoidant attachment. We talked about anxious attachment. These are things that should be treated by a licensed clinician. And emotional dysregulation, not just being a little off for the day, but actually struggling with emotional regulation. This should be treated by a licensed professional. Not every problem requires clinical treatment, but clinical problems deserve clinical care. Why do people become overly dependent on social media? I had a conversation with someone and they were like, well, everybody should just know that when you are looking at social media, you just got to take it with a grain of salt. And not everybody thinks like that, right? There's people like myself that are fully qualified, and I'm using social media as a medium to get the word out to more people. But there are plenty of people who look at social media people, influencers, licensed clinicians, and they hang their hat there. They say, oh, that's my person, and that's who I go to for all of my source of information. Why do people do that? Accessibility. It's immediate, it's convenient, it's free. You can go back. You can go to my YouTube channel and watch any of these replays. There's plenty of people. You just scroll their feed, and there's all types of information and tidbits that you can just grab. It's immediate and it's free. Also, emotional relatability. People feel emotionally connected to creators that just sound good. If you sound good, you talk good, then yes. If you do something that makes people see themselves in you, whether it's how you dress, talk, walk, where you're from, if you sound confident and you seem relatable, then yeah, people are going to be drawn to the creator. Creators make people feel validated because we're saying things and we can see patterns in you, and then you're like, oh my goodness, somebody gets me. And then people online, they share relatable experiences. One of my favorite things to do is just watch story times. I love a good story time. I think that they're funny. It's even funnier when I can relate to them. But people love that. Emotional relatability is absolutely a reason why people are dependent on social media for mental health. Also, people desire quick answers. A mental health journey is really a journey. Anybody that's ever began it, you know that it's just not as simple as going to talk to the lady two or three times and then poof, it's all done. So a lot of times people who are overwhelmed, they're looking for clarity. They're looking for relief. They're looking even just for some language for their experience, and they just want it quick. They're just looking for some quick answers. Like, give me something that's going to alleviate what I'm experiencing. Because maybe they're not ready for the investment, or maybe they don't realize the value of the investment when you genuinely invest in the long term. And therapy is still inaccessible for some people. Everyone's insurance has a carve out for mental health therapy. Yet there are still some people that struggle with finding a therapist that's a good fit. Sometimes it's the cost, even if it's a copay. Sometimes it's the stigma. People still feel a way about sharing their personal business with what they perceive a stranger. Sometimes it's time. Sometimes people, their lives are genuinely packed to the brim with activities and work and so on and so forth. They just can't seem to find the time to really sit down with someone and talk. Access barriers, they just make it so that everybody just goes online first. Okay, they can't, or sometimes people just don't know the process of how to go about finding a therapist. And so they just go online, and they talk to the people online. The limits of social media. Online content cannot fully assess your history. Even now, I say, like, if you are experiencing anything, please sit down and talk to someone. The happy hour is intended for educational purposes only. I can't see you. You're not my client, right? So I can't see you. I don't know exactly what's happening for you. But for my clients, I can. I can say, okay, based on the specific things that you've told me about your history, the specific things that I know about you, yes, I can evaluate things from a different perspective. Social media, online content, it can't fully assess your diagnosis. I've had people inbox me and they say, I am diagnosed with this, meaning they know that they have a diagnosis, but social media will not properly treat that diagnosis, not your trauma patterns. not your intergenerational trauma, not your epigenetics. Social media cannot touch that. Only a licensed clinician can. Not your safety risks. We don't know if you are at risk of harming yourself or harming somebody else. Can't touch it. Nervous system responses. We don't know. I'm going to post clips from this video. I have no idea how it's going to impact an individual. I'm doing my best to be responsible about how I administer the information, but I really don't know because I can't see. And relational dynamics. I don't know. You could be reading something and like, yeah, yeah, my partner needs to do this. And if you sat down in front of someone, then we would be like, actually, it's you. We can't assess that online. And a 60-second reel cannot ethically replace a clinical assessment. It cannot ethically replace treatment planning, psychotherapy, and clinical intervention. It cannot replace the hand holding that a clinician does over a period of time in order to make sure that you are growing and healing in the way that you really want to. How to choose the right professional for you. There is a blog on my website. It's called Meet Me on the Couch. 5 steps to finding a therapist. I'm going to link the blog. It's going to be here in the slides. I'm going to make sure that it goes out in the email to just remind people. I literally wrote it in 2021. So I've been giving out this information for a long time and I'm going to keep giving it out. But here's the basic steps. Number one, identify your needs. What are you looking for? Are you looking for motivation? Are you looking for insight? Are you looking for trauma treatment, relationship work? What are you looking for? Because that will determine whether or not a coach is appropriate for you or a licensed clinician is appropriate for you, or a licensed psychologist or a psychiatrist. Psychiatrist prescribe medication. I did mention them, but psychiatrist prescribe medication. Okay. So what am I looking for? If I'm like, you know what? I really want a new job, but I don't know. I'm just kind of motivated. Maybe you need a coach. Or maybe you're having some relational issues with your partner, some communication issues with your partner. A relational coach would be awesome for you, right? So got to figure out, what do I need? What do I feel like would make me feel better or make me improve my life or get me from A to B? And then once you figure out what your needs are, now we take it a step further. What type of therapist would you like to work with? So we look at specialties. I introduce myself all the time. My name is Dr. Glenna. I specialize in anxiety-based disorders, emotional abuse recovery, trauma recovery. I am EMDR trained. That is my specialty. It doesn't mean that I can't treat other things, but it means that this is probably what I do best. So if this is what you're presenting with, I'm probably going to be a great fit for you. Okay. I tell people all the time, I have treated couples. It's not what I do best. So I feel like I would be doing people a disservice to continue to treat couples. I would rather stop, focus on what I do best, and send couples to someone that is better than me at it. This is why we all have a specialty. So look at what their specialty is. What do they do well? Who do they serve? Look at their personality. Part of why I do the happy hour is because it's a great opportunity for people to meet my personality. You get to see how I talk and how I think and how I present information. And if you feel comfortable, if it resonates with you, then great. We would work well together. There will be other clinicians where they're not a good fit for you. Being able to research people kind of helps you to assess that in advance, and the type of availability. COVID was COVID, but the blessing of COVID is it taught us how to do things virtually. It taught us how to use technology in order to communicate to one another. So I love live sessions. I probably always have an office and always offer live sessions because I do feel like there's a different vibe when you're sitting face to face in the room. But virtual sessions are also effective. EMDR, brain spotting, those treatments are equally effective live in the office and virtually, which means find a person where the type of availability that they have is a good fit for you. If you really desire, like say your house, there's a lot of people living in your house. Working with a therapist that is only virtual is probably not going to be the best fit for you. You don't have enough privacy, right? You can't get to a space where you can really hone in on the session. And if you want to work with this therapist, they have your specialty, they have your personality, but they're a 2 hour drive away from you. That's probably also not going to be a good fit. So pay attention to their specialty, who they are as a person, as much as you can gather, the type of availability. These are just examples when we think about what kind of therapist would you like to work with. Number three, start your search. If you want to use your insurance to pay for your therapy sessions, I recommend that you contact your insurance company and ask for a list of approved providers. Look on the back of your card, call the 1-800 number, ask for mental health, ask for behavioral health, and say, will you please email me a list of approved providers within, I don't know, 20 miles of my house or within a certain zip code. I recommend that because it's much more effective versus you calling 10 different clinicians and they say, no, I don't take your insurance. Insurance is interesting. You know, you can have Blue Cross Blue Shield, you can have Blue Shield, you can have Aetna, and then there's little nuances in between. So the best way, if you desire to use your insurance, the best way to go about it is to call your insurance company first. Get a list of providers and call from that list. Also, if you're open to paying out of pocket and not necessarily using your insurance, there's lots of websites that you can visit. Therapyforblackgirls.com is a great one. Psychology Today is kind of the gold standard. Everybody's on Psychology Today. And search maleblacktherapists.com. Those are three websites that can provide you with licensed clinicians. And you just put in your zip code and it'll pull up people in your area. Number four, make contact and follow through. Make contact according to however they receive contact. For some people, you can send them an email. For some people, they want you to call. For some people, like on my page, I have a little form that you fill out. It helps me to keep track of everyone. And it also, I have a system, an internal system that helps me to keep track of, did I call you? Did I respond with some additional resources? So it helps me to stay on top of things. So make contact in whatever format that they need you to make contact with. Clinicians, coaches, we are talking to people throughout the day. So if you call us, we're probably going to miss your call because we're probably sitting in session or we're doing something like teaching the happy hour and our phone is on D&D. So if you follow the instructions, then they'll surely get back to you in a reasonable amount of time. And then the follow through is don't just get the number and not call. Get the number and actually call them. If they call you back, answer the phone. If they send you an email, respond to their email. But you have to actually follow through. It's not enough to just start the process and then just kind of let it hang. And number five, try 3 sessions. Now, this is not a requirement, right? It's not a requirement. Sometimes you do the intake and you know this is not a good fit. That does happen. Not all therapists are, not everybody is a good fit for everybody, and that's okay. That's normal. But your very first session is going to be your intake appointment. That's where we're going to ask you a lot of questions about your psych history, your social history. We have to ask a lot of questions about you in order to learn who you are and how we can best help you. And second, after your intake is your assessment and your treatment plan. So this is where we're basically saying, based on everything that you've told me, this is how I think we should move forward, right? For all of my clients, I always say, this is my quick and dirty assessment because I've only met with you for about an hour, and this is kind of what I see and how I think that we should move forward. Also, in your very first session, which is your intake and your assessment, you should always fill out informed consent. Any licensed clinician needs to have you sign informed consent. Informed consent is kind of the rules of what happens in therapy. It's kind of the contract to say what happens and what doesn't happen. So you'll have a copy of it. They'll have a copy of it. You are not their client if you have not signed informed consent. Okay. And if you ever meet with someone and they just start talking and there is no informed consent, then something is wrong. That is for licensed clinicians. Coaches often have some sort of assessment, something that they're using to evaluate what your needs are and how you guys are best going to move forward, in addition to some sort of informational session, which is usually the first. A coach is not required to have informed consent, but they usually have some sort of formal evaluation. Licensed clinicians are required to have informed consent before they continue and do any form of intake. Every session after your intake appointment is going to be about a 50 to 60-minute therapy session. Some people do 30 minutes. I don't think that that's best, especially when you're first starting out. You probably need more time than that. But a 50 to 60-minute therapy session is about standard. And so your first session is your intake and your assessment, where you should sign informed consent. Every session after that is your standard 60-minute therapy session. I say try 3 because your first is an intake, and then the second are 2 more therapy sessions. And so it gives you a feel for how the person operates, the type of clinician that you are, and whether or not you'll really be comfortable. we ask a lot of questions in your first session. We don't give a lot of feedback in your first session, but your second and third, well, that's a little different, right? Then we can, give you some homework and kind of learn more about you, so on and so forth. If after a couple of sessions you don't feel comfortable, you feel like you can't open up, you feel like maybe the clinician has done something that made you uncomfortable. I've heard people say the clinician talk too much about their self, or all types of different things, but then you terminate. Don't ghost. Terminate. Call the clinician, send them a text message, and email, and say, thank you very much for your time, but I don't want to move forward. It's your choice as to whether or not you want to give them feedback, but don't just ghost. Okay. It's okay to tell them it's normal. We have a word for it. We call it termination. So it's normal that sometimes people are not a good fit or a good match. And really, the goal here is to get your needs met. It's not about our ego. It's not about what works best for us as clinicians. It's really just about what helps you. And again, everything that I just said, it's mapped out in a longer blog post. It's called Meet Me on the Couch, 5 Steps to Finding a Mental Health Therapist. It is on my website under resources and blog. And you can dive more into more of the specifics in terms of how to go about finding a mental health professional. So that is what I have today. A little bit shorter for today, but that's okay because I'm also going to offer 3 more interviews. I'm interviewing Melissa Dumas, Naja Hall, and David Burris. All 3 amazing people that I adore and really respect. And I will be posting those interviews along with the replay for the happy hour. So thank you very much for joining me, and I will see you next week.